Hey, you guys. So I just want to briefly talk about what kind of things that you want to tell the provider when you call or text them. So depending on where you work, you may be using like the Teams app. You may have the privilege of texting your provider, or they may be on the floor. But if they're not on the floor, and you're using Teams app, make sure that you know your login information, things like that. Make sure that you know, usually when you send the provider a text message or a message through Teams app, on the far right of the message, it's going to come up like an eye symbol, and it looks like an eye with a little eyebrow. That lets you know that the provider has read the message. If the provider had not read the message, usually on the far right, it's going to have just a little check mark. And this is in the Teams app through Epic charting system if you use Epic. Now, at the top of the Teams app in the Epic charting system, or you can also go to teams.microsoft.com. That's another way to get to the Teams app if you don't have the app on your computer, on your CAL. It's going to show whether the provider is in do not disturb mode, is online, offline, things like that. So usually if it's green, a green dot by the provider's name or picture, they're online. Usually if it's yellow, they're like maybe they stepped away. So I want to tell you guys a quick story. I can't give you guys names, of course. I can't do that. But I have to reach out to the provider. There's always something that the nurses have to reach out to the provider for. So I'm gonna use this story. So I had a patient. Patient's blood pressure was the patient was hypotensive. So a good trick here, if you had watched my other videos about, I think I did one about blood pressure. So put the patient in Trendelenburg position. Please check out that video. And also to raise the blood pressure, we usually put the patient in Trendelenburg. We If we have an order, we put TED holds, or we'll elevate the feet of the bed just to get some blood back to the heart to raise the pressure up. So this patient's blood pressure was low, and he was becoming symptomatic. When I say symptomatic, for a patient who has low blood pressure or anything like, especially low blood pressure, we'll say low blood pressure, they're going to have dizziness. They may have low oxygen because, as you remember, with blood carries oxygen. So when you don't have enough oxygen or enough blood, you don't have enough oxygen. So the O2 stats could drop. They may have cool, clammy skin. They may feel dizzy, lightheaded, things of that nature. And so the patient wasn't dizzy at first, but then he later expressed that he was dizzy. His blood pressure was like low 90s. And so I reach out to the provider. Sometimes the provider may say, they'll put in some lab work. In this case, they did like a lactic acid and some other like troponins and things of this nature for this patient. Not troponins, but it was like a WBC, a BMP, and I know a lactic acid came back very elevated. It was like 5.2. So knowing the causes of what causes a high lactic acid could be infection is one of the things that causes the lactate to go up. In this case, the patient was then put on antibiotics and some fluid. He was put on also LR to kind of bring his blood pressure back up. So he kind of maintained that 100 status, but the doctor also stopped the Lasix. He was getting Lasix, spirolactone, metoprolol, and it was another medication. But anyways, all these medications cause the blood pressure to lower. So I reached out to the provider to see whether these medications should be held or just, what should I do? So the provider did tell me that I should hold some of the medications. So things that the provider may ask you when you have to call them or text them, they may ask you, okay, they may want to know what was their vital signs. Full sets of vitals is always important. Also, pain too. If the patient is asking for pain medicine, you want to include what their pain level is, of course. But full sets of vitals, blood pressure, heart rate, oxygen, and temperature. Because, like I said, a high lactic acid can indicate that there's some type of infection in the body, and this patient was put on piperacillin. slash Tazo. And so IV medication. So just know that that's one of the things you want to look out for. They may also ask you too, depending on what you're asking the provider for and what's your concerns, different things they could ask you. So if you have a patient who's coming here and they may want to know, of course, their history. Do they have a history of such and such? I had one provider ask me about another patient who had an arrhythmia, and they want to know, like, what's the beats of that arrhythmia? How many beats did they have? If they were in AFib, how many beats of AFib were they in? How long did it last? They want to know these types of things. And you're not going to have all the information at one time, but you're going to have to get this information because some doctors are very stern and direct. Not all your providers are the most friendliest to talk to. Some providers, I'm just being honest, they will cuss you out. And that's just the honest to God truth. So make sure that you try to at least have your ducks in order. Try to do what you can before. Like I said, if it's an urgent need, and you can't get to the provider for whatever reason, they just took too long to respond, you need to call rapid response. And I'm just trying to think about other questions providers ask, because it could be a variety of different things. If you have a patient with CHF, they may want to know, okay, what's that patient's weight? Have they been losing weight? Have they been gaining weight? And so just be familiar with your different types of blood work, your WBCs, your BNPs. Your WBCs tell us about the white blood cell counts, usually indicative of like infection. Your BNPs tells us about the creatinine level. This patient who had that low blood pressure, his creatinine was probably increased, which I believe it was, looking back at his chart, that the creatinine was increased. Why? Because he was high and dry. He was dehydrated. He didn't have enough fluids going in. So that would then cause the kidneys to overfunction, which would cause a high creatinine level. And so these are just things I want to help you guys, because as a nurse, like I said, there's not going to be things that the answers to everything. You got to continually learn. You got to continually listen. You got to be diligent. You got to know your patient. You got to be responsive. You got to take heed when it's time to take heed. And like I said, there's some providers that have, cussed at me and cussed at other nurses. So this is what you should expect. This is not nothing new. So I just want to make you guys aware. So when you become that nurse, which you will become that nurse one day, that you're going to be prepared for this, y'all, because nursing has its ups and it has its downs. And it has its days like, okay, I'm glad I did it. And it's like sometimes it's like days like, like, why didn't I think of that? And as I say that, it's like so important that you guys, it's so important that you have other nurses who know more than you. Never get jealous, never get upset of someone who has more knowledge than you, because they can help you, help save a life, help prevent some danger, help prevent harm. Because sometimes when you're in a situation and you may be like in panic mode, God may send someone else to help you who can see what you can't see in that moment. And so it's so important that you take heed and you accept help when needed, because you're going to need it plenty of times. Plenty of times you're going to need help. Plenty of times you're going to wish you had help, and you may not have help. So you still need to know what you're doing as a nurse, but understand too that you got to be willing to learn. You got to be willing to always set out to be the best, do the best, and most importantly, make sure your patients are your first priority. I said that my patients are like my kids, because when they hurt, I hurt. I want to make sure that I'm doing the best care that I can for them. And many nurses are throwing their, putting their stuff out, and they're doing what they can for their patients. And we got to respect that. We got to respect our CNAs. We got to respect our nurses. We got to respect our providers who are putting themselves in the lines, because, it's not easy. It's not easy being a nurse. You can look at us, and say, well, only thing they're doing, they're wearing a uniform, you know, they got it easy. No, it's not easy. So I just want to I want to prepare you guys beforehand so you can have an insight of the game, y'all. So I love y'all. Y'all be blessed.